Hello, welcome to my channel. It has been a very long break. Yeah, I'm back again, Dr. Tony Bob. Yeah, this presentation is regarding the medical and dental council exam. I know in 4 days' time there will be MDCN exam here at the University College Hospital Ibadan. Yeah, so this is regarding the counseling topics. So I'll be doing some picture tests, I'll be doing some counseling topics, as I always do before. Yeah, so if you have not watched the introductory part to the counseling, so I advise you to quickly go through them. So this counseling topic won't be that new to you. So we all know before counseling, we all know the acronyms we use, which is the GADA. The G part is you want to greet your patient, you want to greet your examiner, you also want to introduce yourself, which is part of the greet, and you also want to obtain consent. So I explained the right way to do that. I think there's a way I wrote it by saying, I understand you have a need for counseling regarding so and so topic. I hope I will be of help to you today. You have to show your empathy and everything. Yeah, and you introduce yourself. Please, I will advise you to go through those videos. And the next part of the counseling is the ask part, where you want to ask about the language, you want to ask about the settings, if the patient is okay with the setting. You also want to talk about confidentiality under the ask, and you want to ask about the quick biodata, depending on the patient that is coming to you. And apart from that, also, you also want to take some quick history from the patient before moving to the tail part. So basically today I'll be doing more of the tail part. So the tail part is where the bulk of work is as regarding counseling. So today I will be talking about counseling, contraceptive counseling, yeah, as regarding MDCN exam. So first, after doing your introductory part, then you want to go to the tail, which is the T part. So you want to start with counseling, with definitions. That's the first thing I always say. You want to define what is contraceptives. So we all know and please, in a layman language, you don't want to use too ambiguous words. Please try as much as possible to explain as brief as you are. You remember you only have 5 minutes to give your counseling properly. So the first part is you want to give definition. What is contraception? Method by which we prevent conceptions or pregnancy. Very simple. And please always ask for feedback. Once you ask your patient, do you understand? Do you have any question? It's very important. And you want to explain what is contraceptives. There are tools that are used to achieve this purpose. That's very important. For us to achieve contraception, the tools we use are contraceptives. And please always note that avoidance is the best form of contraception. Please take note of that. So after your definition of terms, you want to move to the types of contraceptions. So we have the permanent types and we have the temporal types of contraceptions. So the temporal types of contraceptions, the permanent types are of 2 major types. They are and please, you have to explain to the patient, this permanent type, they are irreversible. So once done, you cannot, that's for life. So the permanent types include the tubal ligation in female, where you tie where the sperm pass through. You understand? So that the sperm doesn't go and fertilize the ovary again. So the tube are tied here, or ligated and tied. You understand? This is for permanent contraception. And the other part is the vasectomy in men, where the vas deferens, the cauterization of the vas deferens. You can see the vas deferens here is being cut and ligated here. You understand? So the main purpose of both of them is to prevent fertilization and implantation. So there's no fertilization, there's no implantation for these permanent types of contraceptives. And the other types are the temporal types. The number one we're going to be talking about is the barrier method. The barrier methods, this involve the use of condom. And there are 2 types of condom. There's the male condom and there's the female condom. The female condom is called the femidone. Do you understand? And one advantage of this is it's easy for you to get it and it's easy to use. So please, and the other disadvantage are people are allergic to latex. So sometimes it might not be durable. It might burst during sexual intimacy. So these are the things you want to explain as quickly as you can to the patient. Yeah, and the next one is the pills. Pills are also a temporal form of contraceptions. Please take note of that. They're also temporal form of contraceptions. And the first piece we are going to be talking about is the combined oral contraceptive pills. So which contain the estrogen and the progesterone. So they help by inhibiting ovulations and they cause thickness of the mucus and they cause this endometrial atrophy. So this is mostly used in patients with who are younger, who have young age, and who can adhere strictly to the pills. Please, very important. MDCN will ask you. This might not be in your counseling, even in your general question. They might ask you the contraindications to the pills. So you also want to let the patient know that people who have migraine, people who are diabetics, people who have stroke, and any blood disorders, coagulative disorders, they should not use combined oral contraceptive pills. They are contraindicated in this. And you can see a picture like this. And in your picture test, MDCN could give you a picture like this and ask you to identify. Please take note. This is a combined oral contraceptive pills. This is how it looks. And you have the one with the 7-day placebo here. Please take note. So we also have the progestin only pills, your Prostinor 2. They can also bring a picture like this. Please take note. Prostinor 2. So please, the contraindication for this is irregular bleeding. You understand? And it's used in patients who are contraindicated, who have contraindication for combined oral contraceptive, maybe patients who have migraine or diabetes or stroke. So you want to use things like the progestin-only pills, the Prostinor 2. Very tricky questions. MDCN do ask these questions a lot. They could ask you what are the non-contraceptive use of contraception. So they will ask you in your exam. It can be in one of the OSCE stations apart from counseling. So one of it is acne. You can use contraceptives to treat acne. You can use it in case of amenorrhea, in case of endometriosis. Please take note. This can be used in this case. Okay. And we're going to also talk about other methods outside the barrier method are the injectables. The injectables, they are given in form of injections. And the number one we're going to be talking about is the Depo-Provera, which is the dipomedroxyprogesterone acetate. So this is the best one you use in a lactating mother, a mother who is breastfeeding, somebody who is breastfeeding. And in patients who cannot tolerate other form of contraceptions, you want to give the injectables. Some are given every 3 months. And yeah, they are given every 3 months. But the disadvantage is weight gain. If you don't like injection also, some people don't like needle prick. So this is one of the disadvantages you also want to explain to the patients. And the other types are the implants. The implants, we have about 3 types here. We have the non-plant, we have the implantor, and we have the Jadel. Depending on the number of rods, also determines how long it will be, the duration. Okay, so it's mostly placed in the upper arm, and it's very easy to use. But the disadvantage is bringing it out can be difficult. Sometimes can be really difficult. So for the implantor, it has 6 rods, which will last for 5 years. And we have the non-plant, sorry. An implantor is 1 rod for 3 years, and the Jadel is 2 rods for 5 years. Please take note. And the other types are the intrauterine devices, which is the IUCD. You can see one of it here. MDCN could display a picture of something like this and ask you to identify them. So this is IUCD. So it's inserted inside the uterus. And this is actually one of the best, if I would say, because the mechanism is it produces some inflammatory reaction that is toxic to sperm and even the eggs, so prevents pregnancy. There are different types, but the most common one is the copper T300A. Copper T300A. Please take note of this. And the other method of contraception, apart from this one I've listed, others are the natural method, which is called the coitus interruptus. is when the man knows when he wants to ejaculate and withdraw, also known as the withdrawal method. And there's a calendar method, okay? And the abstinence is always there, which is also another form of contraception. However, these are the major form of contraceptions. There are still more to it, but for your counseling topics, with this is enough. Within 5 minutes, you should be able to explain briefly and shortly. Please see if you have other questions or later, you can always write in the comment sections. And if you have any particular topic you want me to make a presentation on, please, you can also let me know in the comment section. So please, these are the main things you need to know. You want to explain what is contraception. You want to explain what is contraceptive, the type of contraception, which are the permanent and the temporal, and the tubal ligations, the vasectomy, which is the permanent form, and the temporal form, the barrier method, the using the pills, the type of pills, and also you want to explain the non-contraceptive use of contraceptions. You want to talk about the injectables, and you also want to talk about the implants and intrauterine contraceptive devices and the other method of contraceptions. Please, if you have any question, let me know. If you have any topic you want me to talk more on, and if you have any counseling topics and any more of picture tests you want me to post, kindly let me know. Kindly please subscribe to our YouTube channels and follow us on Instagram and X and also TikTok. Thank you.